Hi, everybody. I'm Sarah Rosen Wartell, and I have the great honor of welcoming you today for the 7th in our series of discussions with leading changemakers and urban analysts on questions emerging from the COVID crisis. And today we're going to talk about essential workers and caring workers in the U.S. economy. A few housekeeping notes. The event is being recorded. The recording and relevant links will be posted online after the event. You're muted. But please type your questions or comments into the question box at any time. We'll try to bring them up at the end of the conversation, but even if not, it's really helpful to us to hear what you're thinking about. And I encourage you to join the conversation on social media at live@urban. So today we're talking about 3 simultaneous challenges: an extraordinary pandemic crisis of health, an economic crisis, and a long overdue awakening to the extent to which racism and its legacy remains embedded in our institutions, including, as we're going to talk about today, in our labor market, and as a result yield terrible consequences from the health and economic crises on essential workers, those who do caring work, many of whom are people of color. A recovery, however, is also an opportunity to reimagine what our society might look like. If we have intention and fierce determination, it's possible that we can build back better, and in fact not allow this crisis to further bake inequities into our society, but in fact build towards the kind of society that we want to have. Urban was honored to host something called the U.S. Partnership for Mobility from Poverty, and Aijen was one of the members of that extraordinary group, which worked together for 2 years to reimagine what we would like our anti-poverty efforts to look like in this country. And one of the important contributions they made was the idea of a definition of what economic mobility, what our aspirations should be. And they wisely said that it's not just this idea of economic well-being and forward progress that we want everyone to have a chance at. But it's more than that. It's also about having the dignity that comes from having power and autonomy over one's life and a sense of being valued and belonging in your community. Workers in the healthcare, health, food, transit sectors, caring sectors have long been too often invisible and are not given that dignity, that concept of being valued and seen in our society. But at this unique moment, we are increasingly understanding and applauding them as essential. And today's conversation, we have 2 fabulous folks to talk about how we can bring dignity to essential work of all kinds. Aijen Poo is the co-founder and executive director of the National Domestic Workers Alliance, and we're also with Elisabeth Jacobs, who's a senior fellow focusing on issues related to economic security and economic mobility here at Urban. Aijen's organization is the National Domestic Worker Alliance, NDWA, and she is also co-director of Caring Across Generations. And NDWA is a nonprofit organization that works to bring quality work, dignity, and fairness to the growing number of workers who care and clean in our homes, the majority of whom are immigrants and women of color. In 12 short years, with the help of more than 70 local affiliates and chapters and over 2,000 members, the National Domestic Workers Alliance has passed domestic worker bills of rights in 9 states and the city of Seattle, and brought over 2 million home care workers under minimum wage protections. Elisabeth Jacobs focuses on work on economic mobility. She recently testified before the House on worker protections and how family and medical leave supports help workers in many ways. And more importantly for today's conversation, she stood up WorkRise here at Urban. WorkRise is a successor to the work of the U.S. Partnership, and it's a network for jobs, workers, and mobility, a platform bringing together researchers, employers, advocates, service providers, policymakers, and philanthropists to try to fill critical knowledge gaps on creating economic security and pathways to opportunity, the kind of economic mobility that the partnership defined for more workers. And it's going to be doing pilots and testing potential solutions with research partners in the goal of a more equitable and resilient labor market. So we're going to talk today about this moment and shifts in public perception of workers who've always been essential, but now we understand that differently. We're going to talk about how these workers are experiencing the COVID crisis and talk a little bit, especially I think, eager to hear Aijen about an agenda, specific policy tools that not only policymakers, but also practice tools that employers could make to make essential jobs good jobs and better pathways to opportunity. So Aijen, let me start with you. Thank you for being here. Essential workers have always been essential to our economy and our society, but kind of for the first time, we are using that language. So I want to ask you to talk a little bit about what does it mean to be an essential worker and how should we think about this group of workers today?
Thanks so much, Sarah, and thanks everybody for tuning in to this really important conversation. So essential workers are the workers across very many sectors of our economy who have essentially kept us safe and kept our economy moving forward in the midst of this pandemic. And the thing that's so profound about it is that I think initially we started to see the initial understanding of essential work was the workers in the healthcare sector, like doctors and nurses who are really on the front lines treating people who became ill. And then we started to see so many other sectors of workers, whether it's the grocery workers who made sure that we had food, and then the farm workers who are continuing to grow the food and pick the food, the delivery workers who make sure that we're getting the services and the supplies that we need in this moment. So many sectors of our economy have been revealed to us as essential to the daily lives of millions of people in this country, and yet they've been invisible to us this entire time. And the irony of it all is that they're incredibly essential, and yet many of them work in poverty wage jobs in these industries where they don't have paid time off, they don't have access to benefits or a safety net, and they earn extraordinarily low wages that are very hard to sustain and support a family on. And so I think the big reveal is that there's actually a huge number of workers who've been invisible to us in our economy who are undervalued in a profound way and deeply insecure, and yet they have been the ones to keep us safe and to keep us moving. And it's disproportionately women and women of color, Black women and other women of color who are working in these jobs. Many of them are primary income earners for their families, and all of them have children home from school as well. And so there's just a whole set of needs that are really needs that we've always had, that have been revealed in terms of how we have not supported our essential workers. And so this is the moment of opportunity, really an unprecedented opportunity to address and solve for the dignity of work and how we support everyone who's working in our economy.
So I want to come back to the how in just a moment. I wanted to first ask Elisabeth, it's not necessarily an accident that the populations that are working in these jobs that are too often unseen are disproportionately folks of color. We have a long history of occupational segregation. What does the research and data tell us about who these workers are and what are the barriers they face to opportunity?
Sure, it's a great question, and Aijen gave us a great lens in. So as she noted, these workers are disproportionately women, they're disproportionately workers of color, they're disproportionately low income. So we know from some new research actually from a team at Urban supported by the Robert Wood Johnson Foundation, they have some preliminary data that matches what Aijen has just noted, that primarily essential workers can't work remotely, they're disproportionately Black or Latino, they're disproportionately low income. This is not surprising given what we know about the wages in the fields that these workers operate in, particularly in care work. There's some very highly paid care workers, doctors, some nurses, but that's not, those weren't the invisible workers before. It's the home health aides, it's the nursing home workers, and those workers are paid really, I think, to many people, what would seem like a shockingly low wage given the work that they do. It's about $13 an hour on average for doing the work that right now is absolutely impossible to ignore as really essential. And Sarah, to your point, I think we at one point talked about, are these good jobs or not? And I would argue some of them are good jobs, right? Some of them they can be, and that's shown us that these don't have to be These don't have to be jobs that aren't paid well, that don't come with benefits. There are lots of reasons how they can and they should, but right now the vast majority of them are not, right? We just talked about the wages, but as Jen noted, lots of these jobs don't come with paid sick leave. They don't come with paid family medical leave. They come with no pathways up for opportunity. And so they're not particularly good jobs. And there are reasons for that go back deep into our history and have kind of been baked into the way that we've done policy for a long time. And I think are really ready, I hope, coming out of this crisis to do policy in a very different way that really corrects for some of the things that are still baked into how we've done things in the past.
So Ajin, just quickly, for the care workers that you represent, just talk a little bit about the crisis, the health crisis, and the economic attendant crisis. How is that landing on these workers?
Well, I think the workforce that I work with is a really great example of what is happening at large to essential workers. Domestic workers came into the crisis with a tremendous amount of insecurity. Most earned very low wages. There was 82% didn't have a single sick day, no access to health care or paid time off, paid family leave, for example. And so just a tremendous amount of insecurity. And really early on, even before the stay-at-home orders came through, domestic workers were starting to see dramatic losses in jobs and income. So there's no job security either. And so food security became a huge issue really early in the crisis. And it's been just a crisis of impossible choices. Do you work and risk your own health so that you can keep your family safe and put food on the table? And then there's a whole set of workers who continue to work through this crisis as part of our essential workforce. And home care workers are a great example. These are workers who are, in many cases, the only lifeline to some of the people who are the most vulnerable to the virus itself: older people, people with chronic illnesses, people with disabilities. And they were going to work, right? Taking public transportation at reduced hours of service, sometimes 2, 3, 4 hours to get to a job, to a client who was really waiting on them for food, for medication, for support and activities of daily living. And they continued to work. And meanwhile, their kids were home from school. So they sometimes had to take their kids to work with them or figure something out. And no increase in pay. The average annual wage of a home care worker in the United States is $16,000 per year. So this is the kind of impossible situation that essential workers have been put in. And now, as states are starting to reopen, a lot more people are starting to go back to work, but there isn't access to protective equipment. There isn't increased access to healthcare. And a lot of people are very concerned about their safety. And so it remains an incredibly devastating and challenging time where essential workers who've cared for us through this crisis are essentially not cared for still in this moment.
So, Elisabeth, there is also likely to be transformation to our economy that will happen in ways that now even beyond just care work, but to many of these essential jobs that are low-wage jobs. Industries are thinking about how they can do with less labor, with less real estate square footage, lots of other things. David Otter has said that, also a partnership member, a WorkRise partnership member, has said that he fears that we'll see a decade worth of industrial transformation in less than a year. Can you talk a little bit about what this may mean for if we do nothing, the future prospects for many of our essential workforce?
So I think we need to think about who we're talking about and how technology might interact with their work. So for the care workers in particular that Ijen's spoken about, and others even in institutions, I think a lot of that is actually potentially not dramatically impacted by technological transformation, because the nature of the work involves connecting with another human being in place. And that just isn't fundamentally going to change. I mean, call me an optimist in terms of the power of human relations that come into play with care, but I do think there is a fundamental human connection that technology can aid with that, that there are ways that technology could certainly be used to, for example, protect essential workers, right? There are massive technological advances that we could use to make sure that the kind of work that can't be done remotely, that requires being in place, becomes safer. And there's some work that just technology will never be a substitute for. Separately, if we're thinking about how technology might affect some of the service industries we're talking about, I think that's another conversation. And again, I think it's really important to think about the way that first developed technology can complement work. It can make work better, more productive, safer, faster. It doesn't have to substitute for labor. And we also have some control over how it's used, who it affects, and how we sort of how we deal with the fact that if it does displace some workers, we can do something about that and make sure that doesn't mean that we're just discarding them in ways that in the past, I think we've potentially overlooked the power of policy to kind of control what technology does. So I would leave it at that, because I think it's a very long conversation, maybe another one of these these series, but that's some food for thought in response to the kind of, are the robots are coming faster because of COVID question.
I think the takeaway is to be intentional and to think about the human consequences through the process. So in the thinking about human consequences, Ajahn, you have been working on a policy framework. I think you had an op-ed this week that was published, was it in the Times? And really terrific. Encourage people, will put it on the event page, but to look for that. But starting to think about, if we want to continue to value essential workers in the period ahead, what are some of the steps that we ought to be taking at the local level as well as at the state and federal level? You want to talk a little bit about that?
Sure. I just want to pick up on a thread about care jobs for a second, and then I'll come back around to essential work. Care jobs have, even before the COVID crisis, among the fastest growing occupations in the entire US economy, because there is such a huge demand that's not going away, particularly as we have an older population that's living longer than ever and growing. And so as we start to think about what it looks like to get America back to work again, and we start to think about the kind of jobs programs that we're going to need, these are jobs, as we said, that aren't going to be automated, at least not anytime soon. They're not outsourceable, and these are jobs that are clearly needed, and they've never been good jobs. We've never invested in them and made them good jobs. And I would just say that it's such an obvious place where a public investment in these jobs is such a win-win-win, because these are not only jobs that could be family sustaining jobs for a huge number of workers, but they are also job enabling jobs. These are jobs that help other families actually go to work and do what they do in the world. And so that's a place where I think there's an obvious case for investment and transformation. In the short term, the short to medium term, I do think that this moment for essential workers is a moment that we all need to rise to. We have at the federal level, Senator Warren and Representative Khanna have created a framework called the Essential Workers Bill of Rights. And it defines essential workers broadly enough to include all the sectors that have been invisible. And it includes a broad suite of supports that we know are essential to essential workers. And it's everything from hazard pay for the amount of risks that essential workers are taking on, to worker protections that protect people from retaliation if they assert their right to PPE. There's just a really comprehensive way that they've talked about it. And some of the provisions of the Bill of Rights are in the HEROES Act that passed through Congress and is awaiting the action on the part of the Senate. So let your senators know that now is the time to support the workers who kept us safe in this crisis and continue to, because it's not over yet, right? And I do think that states And cities can also act on their own versions of essential workers' bills of rights, and include essential workers in the process of reopening and thinking about what the terms of reopening our economy should look like in a way that really keep essential workers safe. So there's a role for every level of government to lead here and to really stand with essential workers in this critical time. And I think employers also can model what it looks like to support essential workers. We've created a set of guidelines for domestic employers, people who hire workers to come provide services in their homes, that can be found on our website, employers.domesticworkers.org. And it really is a team effort. I think if anything, this crisis has shown us how interdependent we are as a country. And it's the least we could do to open up the conversation with essential workers directly about what they need in order to stay safe and really drive those solutions forward.
So Elisabeth, thank you for mentioning, again, the role of employers. Elisabeth, one of the things that WorkRise hopes to test and pilot and build evidence around are what kinds of practices for employers, what are the results that those yield for their workers, and also potentially what are the results that some of the employer practices might yield that inure to the benefit of the firm, because we, I suspect, have at least a hypothesis to be tested that firms may find that that the more their workers have the dignity and that sense of value that we're now giving our essential workers, the more likely the firms will continue to thrive as well. So can you give us some examples of some of the ideas that you are seeing and hoping perhaps to be able to test in this process?
Yeah, I mean, I think it's useful to go back to when the economy looked very different and think about what employers came to the table thinking hard about, and then to trace that forward. So prior to COVID, employers were really eager, I think, to figure out how to create quality jobs in a very tight labor market. They realized they had to compete for workers even all the way down to entry-level, very low-wage jobs. And we're thinking hard in some sectors really about how do we make those jobs better jobs. Everything from better wages to benefits like paid leave, paid sick leave, the kinds of things that we've talked about. And the real open question now, I think, for many employers is, how do we do those things when the labor market is essentially fallen apart, right? And how do we rebuild into a space where we're not facing the same challenges? And so I think there's all kinds of things we'd like to test out and that employers are interested in doing. So I think many of them do want to do the right thing because they've seen the consequences of stalled mobility pathways for folks who start at the bottom. And there's really an open question in terms of how do we do it and what will we see? What kind of evidence can we see given what we've seen in terms of how much we depend on these folks who are doing the care work, who are doing the essential work. What can we give them at an employer level to actually move forward and get some security? The other thing I would just add to Aijen's point of the sort of back and forth between employers and public policy is just remembering that in many cases, the employers for these workers they're not big firms who can do a lot for their employees because they're a family or they're a small home healthcare business that essentially is run by a former home healthcare worker, and their customers are the same people that they're serving, right? They're very low wage folks. They're people who are struggling to make ends meet. And it's a reminder that I think there is a public role here. There's a role for employers, but there will never be a sort of competitive labor market for care work, for example, because care is a public good. It requires kind of wraparound public investments to support the kind of practices that we want to see at the employer level as well. So there's lots to test out, including that interaction between private and public practice. And I'm super excited to see what comes out of WorkRise, because we've got folks from across that landscape who have tons of ideas and are really hungry to see what evidence is out there and what works in kind of this brave new world that we're in with the pandemic, and going forward to build into something very different from what we left behind.
So I want to apologize for taking 4 minutes of our short event time with my broken mic. That was terrific ambition for the future, Elisabeth. Aijen, any last 20 seconds of ambition and what we should be imagining to build back better?
I just hope all of us really remember what it feels like to to rely so heavily on our essential workforce and know that we still have so much work to do to protect them.
Thank you so much for being here, both of you. Thank you to everyone who joined us for this conversation. And after the July 4th week, I hope you will check back in. We will continue this series with important change makers and the evidence that we need to help advance change. Be safe, everyone, and hope to see you soon. Thanks again, everybody.